For a better understanding of the Zika virus and the dangers it poses, we're joined by Kathryn Jacobsen. She's a professor of epidemiology at George Mason University. Welcome back.
Thank you.
Just coming out of the report there from Brazil, how dangerous is it in the middle of Carnival?
Well, the epicenter of the Zika outbreak in Brazil is hundreds of miles away from Rio. So the rate of infection in Rio may not be as high as in some of the places where the concern is greatest. But obviously, Rio is paying great attention to the mosquito population, and people are taking precautions to avoid mosquito bites.
The World Health Organization is now declaring the Zika a global emergency. What are the implications here, Kathryn?
The most important thing about the global emergency status is that it releases special resources for fighting Zika. And the main thing that resources will be focused on is research. We really don't understand much about Zika yet. So having money to be searching for cases and trying to really trace back to where the cases of microcephaly might be coming from, that's going to be incredibly important. We'll now be gathering data from every country in the world about Zika because of that state from WHO.
Paulo Cabral just said there in Brazil that this is not the only disease they're worried about. There are so many others. What are the other implications?
The other main disease that's spread by the same mosquitoes that spread Zika is the dengue virus that Brazil faced last year. So the rise of the mosquito population last year that caused that probably is playing a role then in what we're seeing this year with Zika. So mosquito control activities are something that'll help with a lot of different infections, not just Zika.
In the United States, the first case of Zika has been shown in a sexually transmitted setting. How do you advise people going forward on this?
Well, for travelers who may have been in an affected area, when they get home, if they did contract the virus, they would probably only have the virus in their body for perhaps 5 to 7 days. So the restrictions on contact with other people would be for a limited period of time. For people who live in endemic areas, the questions are a lot trickier because pregnant women and their partners could be exposed to the virus at any time.
How could this spiral out of control? People are thinking about past diseases and viruses and thinking, what's next?
Right now, we don't know. And as a scientist, we never like to have the answer be, we don't know. But Zika is behaving in a different way than it has in the past. It seems to be spreading more quickly. It seems to be causing side effects that it didn't cause. So for right now, a lot of the recommendations coming from the World Health Organization are based a bit on a worst case scenario, where they're saying, we don't know what the risks are. We don't know how many people might be affected. Let's protect everybody. Let's take steps where we say, try to avoid the mosquito bites, try to avoid unnecessary travel until we understand what's going on.
All right, Kathryn Jacobsen, thank you so much. We appreciate your time.